Hi, it's Dr. John Arlette in Calgary, Alberta, Canada. In this section, we're going to talk about visualizing the temple. The temple is an important structure for us to be working on to fill with filler. And it's an important structure because it has so many layers. And depending on how you choose to inject, it's important to know what is beneath your cannula or your needle, whether you're over vessels, which fascia you're going through, as well as how deep it is and the muscle. So let's take a close look at the temple, really going from the posterior aspect to the anterior aspect. First of all, we'll scan with the B mode, looking at brightness, and then we'll come back looking for vessels. So we've got lots of gel on our device. We're going to orient it. Remember, our little orientation device is at the top because it's vertical. We're going to come into the temple. We're going to make our depth 2.8 centimeters because the temple is really the deepest part of the face where we're going to be able to see what's underneath. So I'm just going to scan forward and give us an idea. And as you practice, you will find that this starts to become a three-dimensional movie in your mind. You'll begin to place that into a three-dimensional view of what's beneath your device. So here we are in the posterior aspect. We can see the temporalis muscle deep to the tissue. We can see fascia at the top. We can move forward. We can see changes in the thickness of the fat layer and of the temporalis muscle. So when we're thinking where we're going to put our injection, we're going to go superiorly along the suture, and we can see how this starts to become superficial, how it becomes more shallow. By making sure you have an adequate gel pad, you can see the gel pad at the top of the screen. If you press, you make that disappear. So you want to be able to see your gel pad to know that you're seeing the actual representation of the tissue below you, all on the basis of the amount of tissue that's normally there without it being compressed. You can see that happen. And so also when you're injecting, it helps you to know that if you're pressing with your hand, you're going to change your location as well as how you move your needle or cannula forward or backward. Vascularity in the temple is extensive. You have a tremendous arcade of veins, particularly the sentinel vein here at the medial aspect. And you'll find it coursing throughout the temple. So there's lots of veins, and we'll just press on this and they'll go away. Now we also want to be looking for the superficial temporal artery because we'd like to avoid that while we're working. And there's the superficial temporal artery. It's relatively small in this circumstance. You can see how everything else clears away with a little bit of compression. And there's our artery back again. And these again are tortuous within the tissue. We can see how our fibrous structures separate as we go down deeper into the temple, as you'll be looking for different locations that you'll want to be injecting into. A very specific technique for enhancing facial features. When we're looking at the temple, there's a number of layers, and whether we talk about it being 10, 7, or 8, think about how we're going to put our cannula or our needle selectively into one of those locations. And for those who inject the temple, this will be a great asset to just confirm your placement both during treatment and after treatment. So we'll just move up a little bit. One of the areas where we see frequent injections is here, about a centimeter above the lateral aspect of the temple, a centimeter down from the suture line. So a very easy place for us to work. On this section, we've talked about the temple, a complex anatomical structure. It's important to go through the area slowly, scanning both vertically as well as laterally, horizontally, in order to get a good appreciation of all the structures that are present and then the interrelationship with the vascular structures that lie below the skin. Thank you very much.